So today we are discussing about submandibular region. So the submandibular region extends from the submandibular fossa of the mandible to the hyoid bone. So here we have the submandibular fossa of the mandible is present here. So up to the just near to the mylohyoid line we have submandibular fossa of the mandible here. It extends from the submandibular fossa of the mandible to the hyoid bone. So what are the structures present in the submandibular region? In the what are the main structures are the submandibular gland and sublingual salivary glands, and also we have suprahyoid muscles. We have discussed suprahyoid muscles at the time of anti-triangles of the neck, and also we have genioglossus, hyoglossus, extrinsic muscles of the tongue, genioglossus, hyoglossus and styloglossus muscles. These are also present in the submandibular region, and we have discussed already in the while we are typing the tongue. And next is the lingual nerve. Lingual nerve is present in the submandibular region, and also hypoglossal nerve is present in the submandibular region. Glossopharyngeal nerve is also present in the submandibular region, and also facial artery and first part of lingual artery. These are the structures present in the submandibular region. Of all these, submandibular gland and submandibular ganglion is very important. So submandibular gland and submandibular ganglion. Coming to today we will discuss about submandibular gland. Okay, submandibular gland. It is a walnut-shaped gland. Submandibular gland. It is a walnut-shaped gland. Consists of superficial part and deep part. Okay, consists of superficial part and deep part along the posterior border of mylohyoid. So this is the mylohyoid muscle. Look here. So this is the mylohyoid muscle. Okay, so this is the mylohyoid muscle. So this is the mylohyoid muscle. So along the posterior border of mylohyoid, the gland divides into superficial part and deep part. Okay, so coming to the superficial part. The superficial part, it consists of anterior end and posterior end, and one more important thing is the gland weighs about 10 to 20 grams, and also it lies in the digastric triangle, and also it lies in the submandibular fossa. So the gland lies in the digastric triangle as well as in the submandibular fossa. Okay, it divides into superficial part and deep part along the posterior border of mylohyoid muscle. So this is the mylohyoid muscle, divides into superficial part and deep part along the posterior border of mylohyoid muscle. Coming to the superficial part, it consists of anterior end and posterior end. Okay, it consists of anterior end and posterior end. Anterior end extends up to the anterior belly of digastric. So this is the black one. I have presented the entire black one. This is the anterior belly of digastric. This is the intermediate tendon, and this is the posterior belly of digastric. Anterior belly. This is the posterior belly of digastric, and this is the anterior belly of digastric. Okay, so the anterior part extends up to the anterior belly of digastric, and the posterior end, it presents a groove. Posterior end extends up to the posterior belly of digastric, and it presents a groove for the facial artery. It presents a groove for the cervical loop of facial artery, extending loop of cervical part of facial artery. We have know that the facial artery before it enters the face, it forms a loop. Okay, so the loop is present along the posterior end of submandibular gland. So the gland presents anterior end, as well as posterior end. Okay, the anterior end extends up to the anterior belly of digastric, and the posterior end it extends up to the posterior belly of digastric, and also it presents a groove for the facial artery, cervical loop of facial artery. Okay, and it on the gland presents three surfaces: inferior, medial, and lateral surfaces. Okay, the gland presents inferior, medial and lateral surfaces. So the inferior and medial surfaces, they are covered by the deep cervical fascia. The inferior and medial surfaces, they are covered by the deep cervical fascia. So the inferior and medial surfaces, this splits here, and this here we have the ramus of the mandible. Okay, the inferior and deep surfaces, they cover the inferior, they are covered by ramus of the mandible. Okay, they are covered by the deep cervical fascia, the inferior and medial surface. So this is the inferior surface and this is the medial surface. So the deep cervical fascia splits. The deep cervical fascia splits to enclose the inferior surface of the gland as well as the medial surface of the gland. It splits to enclose the inferior surface of the gland as well as medial surface of the gland. So this is the gland. The fascia which covers the inferior surface of the gland, which is attached to the lower border of the mandible. Okay, and the fascia which covers the medial surface of the gland, medial surface, this is the medial surface, right? This is the inferior surface and this is the medial surface. The fascia which covers the medial surface of the gland, which is attached to the mylohyoid line. So the inferior and medial surfaces, they are covered by deep cervical fascia. The deep cervical fascia, it splits to enclose the inferior and medial surfaces of the gland. And coming to the relations of these surfaces. Okay, coming to the inferior surface. Inferior surface, it is covered by skin, superficial fascia and also platysma. We know that platysma is a subcutaneous muscle. Okay, so the inferior surface, it is covered by skin, superficial fascia, platysma and also deep cervical fascia. And superficial to the platysma, we have common facial vein and cervical branch of facial artery are present. Cervical branch of facial artery and also cervical part of facial artery and also common facial vein present in the inferior surface, superficial to the platysma, and deep to the pretracheal fascia we have submandibular deep to the deep cervical fascia we have submandibular group of lymph nodes are present. Okay, so the inferior surface it is related to skin, superficial fascia and also platysma and deep cervical fascia. And superficial to the platysma we have common facial vein is present and cervical part of facial artery is present. And deep to the deep cervical fascia we have submandibular lymph nodes are present. So these are the relations of the inferior surface. And coming to the lateral surface. So lateral surface, it is related to the bone. So the lateral surface, it is related to the submandibular fossa of the mandible. The lateral surface, it is related to the submandibular fossa of the mandible. And also it is related to the cervical branch of cervical part of facial artery. So the facial artery forms a loop here, between the bone and the gland, and it enters into the face at the by winding around the lower border of the mandible at the antero-inferior angle of the masseter. So the facial artery, the loop of facial artery is present. The facial artery, it enters the face at the lower border by winding around the lower border of the mandible at the antero-inferior angle of the masseter. So it is related to bone and also it is related to medial pterygoid. It is near its insertion, because medial pterygoid it is inserted to the angle of the mandible. So the lateral surface it is related to submandibular fossa. It is related to submandibular fossa and also it is related to medial pterygoid muscle and also it is related to medial pterygoid muscle and also it is related to facial artery. Between the bone and the gland. Between the bone and the gland we have facial artery. So that's about the lateral surface. Okay, that's about the lateral surface of the gland. Okay, coming to the medial surface. Medial surface, it is very extensive and divides into anterior, intermediate and posterior parts. Coming to the anterior part. This is the anterior part. Okay, the anterior part rests on mylohyoid muscle. So this is the mylohyoid muscle, right? So the anterior part rests on mylohyoid muscle and it is related to mylohyoid nerves and vessels. We know that inferior alveolar nerves and vessels, before entering into the mandibular foramen, it gives mylohyoid nerves and vessels. This mylohyoid nerve, it supplies the mylohyoid muscle as well as anterior belly of digastric. Okay, so the anterior part, this is the anterior part of the medial surface. The anterior part of the medial surface, it is related to mylohyoid muscle. It rests on mylohyoid muscle and it is related to mylohyoid nerves and vessels. Coming to the posterior part. Posterior part, it is related to stylopharyngeus muscle, styloglossus muscle. So this is the styloglossus muscle and this is the stylopharyngeus muscle, and we have glossopharyngeal nerve is present here, glossopharyngeal nerve is present here, and it supplies the stylopharyngeus muscle here, and also it is related to middle constrictor. This is the middle constrictor of pharynx. So this part we call it as middle constrictor of pharynx. Okay, and it is also related to posterior. This is the posterior belly of digastric. This is the anterior belly of digastric, right? So this one is the anterior belly of digastric. And this one is the posterior belly of digastric. Posterior belly of digastric. Okay, so the posterior part of the gland, the posterior part of the medial surface is related to stylopharyngeus muscle, styloglossus muscle, stylopharyngeus muscle. It is related to middle constrictor of pharynx here, and also related to posterior belly of digastric. It is also related to facial artery and also lingual artery. It is also related to hypoglossal nerve here. So these are the structures which are related to the posterior part of the medial surface. So medial surface is related to styloglossus, stylopharyngeus and also hypoglossal nerve, middle constrictor of pharynx, posterior belly of digastric. It is also related to facial artery and first part of lingual artery. And is also related to the green one. I have represented the nerves with green color. So the green one we call it as hypoglossal nerve. This one is the hypoglossal nerve. The green one is the hypoglossal nerve. So the medial surface posterior part is related to all these structures. Okay. And coming to the intermediate part. So anterior part is related to mylohyoid. It rests on the mylohyoid muscle. It is related to mylohyoid nerves and vessels. Okay. Posterior part is related to all these structures: styloglossus, stylopharyngeus, glossopharyngeal nerve, middle constrictor, posterior belly of digastric here, and we have facial artery, first part of lingual artery is here, and we have hypoglossal nerve is here. These are the structures that are related to the posterior part of the medial surface. And coming to the intermediate surface, it is related to, it rests on the hyoglossus muscle. So I have represented the hyoglossus muscle with vertical lines here. Okay, right here the hyoglossus muscle is overlapped by the mylohyoid. So the vertical lines here are nothing but the hyoglossus muscle. So the intermediate part, it rests on the hyoglossus muscle, and it is related to, above we have lingual nerve. Above we have lingual nerve with submandibular ganglion. From the lingual nerve, this is the submandibular ganglion. The lingual nerve, the submandibular ganglion, it is suspended from the lingual nerve by two roots. Okay, so this is the submandibular ganglion and this is the lingual nerve. This is the lingual nerve. Okay, it is related to the lingual nerve, submandibular ganglion, and also it is related to hypoglossal nerve accompanied by a pair of vena comitans. So accompanied by a pair of vena comitans. Here hypoglossal nerve accompanied by pair of vena comitans. They are called this part we call it as vena comitans nerve by hypoglossae. Vena comitans. This part we call it as vena comitans nervi hypoglossae. That means two veins accompanied by, that means hypoglossal nerve accompanied by two veins. So vena comitans nervi hypoglossae, it is related to the intermediate part of the gland. So the anterior part of the gland, it rests on mylohyoid muscle and is related to mylohyoid nerves and vessels, and the posterior part is related to styloglossus, stylopharyngeus, glossopharyngeal nerve, middle constrictor of pharynx, posterior belly of digastric here, and also facial artery is here. Facial artery and first part of lingual artery. Okay, and the intermediate part, it rests on the hyoglossus muscle. It is related to lingual nerve, where it is suspended by submandibular ganglion, where it is suspended from the lingual nerve by 2 roots, and also we have on the intermediate tendon of digastric present, and also we have hypoglossal nerve accompanied by a hypoglossal nerve accompanied by a pair of veins. They are nothing but vena comitant nerve of hypoglossae. Those comes the intermediate relations, intermediate part of the medial surface relations. Okay, so that's about the relations of the medial surface. So the gland is having 3 surfaces: inferior, medial and lateral surfaces. Okay, the inferior surface, it is related to skin, superficial fascia, platysma and deep fascia. Superficial to the platysma, we have common facial vein is there, and also we have cervical part of facial artery is there, and coming to the deep to the platysma, deep to the deep cervical fascia, we have submandibular lymph nodes are present. And coming to the lateral surface, it is related to the bone, submandibular fossa, and also medial pterygoid muscle, because medial pterygoid muscle here it is inserted to the angle of the mandible, right? It is inserted to the angle of the mandible. Here we have submandibular fossa is also nearer to it, so it is related to the submandibular fossa, medial pterygoid muscle near its insertion, or it is also related to between the bone and the gland. We have cervical part of facial artery is present before it ascends into the face at the anterior-inferior angle of the mandible. And coming to the medial surface, it is very extensive and it is having anterior, intermediate and posterior parts. Anterior part, it is related to anterior belly of digastric and it extends up to the anterior belly of digastric, and it is related to, it rests on the mylohyoid muscle, and it is related to mylohyoid nerves and vessels. These are the mylohyoid nerves and vessels. I have represented everywhere the nerve with green color. Okay, and coming to the posterior part, it is related to styloglossus, stylopharyngeus, glossopharyngeal nerve, middle constrictor of pharynx, and also it is posterior belly of digastric. It is related to facial artery, first part of lingual artery. Intermediate part rests on the hyoglossus muscle, and it is related to here above with the lingual nerve and also submandibular ganglion suspended by lingual nerve by 2 roots, and also it is related to the hypoglossal nerve accompanied by a pair of veins, that is called, we call it as vena comitant nerve hypoglossal, and also it is also related to the intermediate part of the medial surface. It is also related to intermediate tendon of the digastric. So that's about the surfaces, relations of the inferior, medial and lateral surfaces of the gland. And coming to the deep part of the gland, the deep part of the gland, it is related medially to the hyoglossus and laterally to the mylohyoid. The intermediate part of the gland, it is related medially to the hyoglossus muscle. This is the deep part, and laterally to the mylohyoid muscle. Above we have inguinal nerve and submandibular ganglion. Below we have hypoglossal nerve accompanied by a pair of veins. So, are the relations of the deep part of the gland. And coming to the arterial supply of the gland, the artery, here we have lingual arteries and facial arteries are present. They supply the gland. And coming to the lymphatic drainage here into submandibular group of lymph nodes, and they drain into jugulo-digastric group of lymph nodes. And coming to the duct of the gland, here the duct of the gland starts from the deep part of the gland. Here the duct runs first upwards and backwards, and then it runs again upwards and forwards, and opens into the sublingual papillae on either side of the frenulum linguae. So the duct here we have a median fold is present from the tongue to the floor of the mouth. We call it as frenulum linguae. So at the frenulum linguae, at the base of the frenulum linguae, we have sublingual papillae present. So the ducts, they open into the frenulum. So these submandibular ducts, they open into the frenulum linguae. Okay, on the floor of the sublingual papilla on either side of the frenulum linguae. So the duct, it is about 5 centimeters long, and it starts at the deep part of the gland. It extends upwards and backwards, and then it extends between mylohyoid and mylohyoid and hyoglossus, and it runs upwards and forwards, and further it passes between the sublingual gland and genioglossus muscle, and it opens at the sublingual papilla at the floor on either side of the frenulum linguae. Okay, and the floor of the mouth. So that's about the duct. And one more thing here is submandibular nerve supply of the gland. Here the important one here we call it submandibular ganglion. So the submandibular gland receives its nerve supply by submandibular ganglion. Okay, submandibular ganglion. So the submandibular ganglion, it consists of parasympathetic, the parasympathetic submandibular ganglion, nothing but a parasympathetic ganglion, the preganglionic parasympathetic fibers, they arise from the superior salivary nucleus from the pons, superior salivary nucleus from the pons, the salivary nucleus of pons. They pass through facial nerve, and again chorda tympani nerve, and through lingual nerve, what happens? Through the lingual nerve, they relay in the preganglionic parasympathetic fibers. The preganglionic parasympathetic fibers, they start from the superior salivary nucleus of pons, and through facial nerve, and through chorda tympani nerve, and through lingual nerve, they relay in the ganglion. They relay in the preganglionic fibers through lingual nerve, they relay in the ganglion. And the postganglionic fibers, they also pass through lingual nerve. And they supply the gland. They supply the submandibular as well as sublingual glands. Submandibular as well as submandibular and sublingual glands. Supply the submandibular as well as sublingual glands. So the lingual nerve carries the preganglionic fibers, parasympathetic fibers, they relay in the ganglion, and the postganglionic parasympathetic fibers, they supply the submandibular and sublingual glands. The secretions or the stimulation of parasympathetic fibers causes watery rich secretions. The stimulation of parasympathetic fibers causes watery rich secretions. Here we know that the lingual nerve, it is suspended by two roots, right? Here this is a submandibular ganglion. Here the lingual nerve is suspended by two roots, right? So the preganglionic parasympathetic fibers, they start from the superior salivary nucleus of pons, and then facial nerve, and then through chorda tympani nerve, and then lingual nerve, and finally they relay in the submandibular ganglion and the postganglionic parasympathetic fibers. So the postganglionic fibers, they pass through lingual nerve and they supply the submandibular as well as the sublingual glands. Okay, the stimulation of the parasympathetic fibers, they cause watery rich secretion. Okay, and coming to the sympathetic fibers, they cause mucus rich secretions. How the sympathetic fibers reach the gland means by forming plexuses around the facial artery. We know that the sympathetic fibers are postganglionic sympathetic fibers. We know that all the preganglionic sympathetic fibers, they relay in the three cervical ganglions, superior cervical, middle and inferior cervical ganglion, and the postganglionic fibers, they form plexuses around the corresponding artery. Here in the submandibular region, here in the submandibular cut, we have facial arteries present here. So they form the postganglionic parasympathetic fibers, they form plexuses around the facial artery and they supply the gland. The stimulation of the sympathetic fibers causes mucus rich secretion, and also they are vasomotor in function. Okay, that's about the submandibular ganglion as well as the nerve supply of the gland. Okay, and here we have lingual nerve is present here. Here the lingual nerve, here it runs downwards, forwards, and it winds around the submandibular duct. Here you can see the lingual nerve winds down the submandibular duct from lateral to medial side, and it supplies the presulcal part of the tongue, general sensation for the anterior 2/3 of the tongue. So the lingual nerve, it runs lateral to the submandibular duct, and then it runs medially by winding around the lower border of the submandibular duct. Okay, and here the lingual nerve, it joins with the chorda tympani nerve at an acute angle. that's why the superior salivary nucleus, the fibers pass through choroid and through the lingual nerve, right? And coming to the this one, hypoglossal nerve. Hypoglossal nerve here is accompanied by a pair of waves. We know that hypoglossal nerve, it supplies the muscles of the tongue, right? That's why hypoglossal nerve, that's about the hypoglossal nerve. And the glossopharyngeal nerve extends, it comes out to the jugular foramen, and it passes downwards and appears in the submandibular fossa, and further in submandibular fossa, and further it goes forwards between the muscles of superior constrictor and middle constrictor muscles, and thus this is the glossopharyngeal nerve. Here in this region it gives carotid branches and also mandibular branches. It gives mandibular branches and carotid branches here, and so three nerves are present here: lingual nerve, hypoglossal nerve and glossopharyngeal nerve. So that's about the submandibular gland. And sublingual gland is also there. Sublingual gland is nothing but a small gland of the three salivary gland. Submandibular gland is a mixed variety gland, and sublingual gland is a mucus secreting salivary gland. Sublingual gland is situated in the or rests on the mylohyoid muscle. It is present between the mucous membrane and also mylohyoid muscle, and it lies in the sublingual fossa of the mandible. And here the submandibular gland consists of many ducts. These ducts open, some ducts they open into the sublingual papillae, and some ducts they open into the the submandibular duct. The nerve supply and blood supply is same, and lymphatic drainage is same that of the submandibular gland. So that's about the submandibular gland and sublingual glands. And here in the we know along the in the sub and also submandibular ganglion, and that's about the these are the important structures in the submandibular region. Submandibular gland and submandibular ganglion are very important. And the suprahyoid muscles, we have discussed them in the anterior triangles of the neck, and extensive muscles of the tongue we have discussed them in the tongue. So that's about the submandibular region.